Hi, I'm Patricia Hewitt. I'm Labour's Secretary of State for Health. And I have to say, I cannot think of a more wonderful job to be doing. I just feel so lucky to be going around the NHS supporting staff who are doing extraordinary things every day of the week. A couple of weeks ago, I was at Barts in London watching an amazing medical team saving somebody's life with a primary angioplasty operation. A couple of months ago, I remember being in a specialist dementia unit with a dementia nurse who was talking about the individual elderly people she and her colleagues were looking after with such loving sensitivity. I felt genuinely humbled to be able to support what she's doing. And as you'll know, we've more than doubled the amount of money going into the NHS. By April 2008, we will have trebled it. And it's because of the dedication of all these staff, over 1.3 million staff now in the NHS, backed up by the investment we've made and the changes and reforms that we're making, that the NHS is now treating more people faster than ever before, saving more lives than ever before. I see it with the waiting lists. They've come down already to the lowest level ever. We've promised even more than that. We've said by the end of next year, we want no more than 18 weeks, for most people it'll be far less, between your GP referring you and you actually getting the hospital operation. Now that'll be a transformation in the NHS, effectively the abolition of waiting, as we've always known it in the NHS. And just last week, we heard from 13 or so hospital trusts who've said that they'll achieve that milestone for almost all their patients for most conditions by the end of this year, a year earlier than we promised in the 2005 manifesto. Or I look at what's happening with cancer care. And over the last 12 or 18 months, and despite the financial problems, we've seen cancer care transformed once again. You know, now, if you're referred urgently by your GP because you might have cancer, you'll get to see the specialist, you'll get through all the diagnostic tests, and if you do have cancer, you will start on your treatment within just 62 days. Only a year ago, over a third of patients weren't being seen and started on their treatment as quickly as that. So that's another extraordinary transformation. And indeed, because of that and the other improvements in cancer care, we're seeing over 50,000 more people's lives saved than was happening 10 years ago. So huge improvements, but also huge changes, real problems, I know, as we sort out the finances, and we didn't have a choice about that, given the overspending of a year or so ago. But the staff have been extraordinary, rising to the challenge, and in particular, NHS going on changing, because medicine is changing and people's needs are changing. One of the things I've learned from NHS staff is that partly because of the changes in medical technology, they can now do so much more for people close to home, in GP surgeries or community hospitals, or even in people's own homes. Tests and treatment that in the past you used to have to go to the acute hospital for. I remember meeting one elderly gentleman in Bedford who was being looked after in his own home by one of their team of community nurses. He no longer ends up in hospital as an emergency admission every other month, which was what was happening to him. He's now looked after far better in his own home. But at the same time, again because of changes in modern medicine, there's very specialist care that needs to be done in specialist centres. The primary angioplasty operation, for instance, that I saw at Barts in London recently, can only be done in centres that have got the right specialist team available 24 hours a day, 7 days a week. And that can't be done in every single local hospital, happily, because there aren't enough patients to support a specialist team at every hospital. So those changes, more close to people's home, wherever that is safely possible, but more in specialist centres where that's necessary as well. Those changes will continue. They won't always be easy. They won't always be popular locally. But I think that if we know that the NHS can improve more lives and save more people's lives by making changes like that, then we've got to do everything we can to support our local frontline staff and to engage the local public in understanding why these changes are happening. Because it would be a betrayal of patients, it would be a betrayal of NHS values if we didn't take the opportunity to give people even better, safer care than the NHS is doing already. Next year is going to be the 60th anniversary of the NHS, and I have no doubt at all that with the extraordinary dedication of NHS staff, backed by the investment and the changes and reforms that a Labour government is willing to make, the NHS will be able to face up to the huge challenges that are confronting the health service in every developed country in the world, and we'll be able to safeguard for another generation an NHS giving everybody the best possible care based on clinical need, not their ability to pay, free at the point of need. Those are the values that brought me into Labour politics, and those are the values that I'm trying to uphold as a Labour Health Secretary.